Your heart may warn you before it fails. That heavy feeling in your chest when you wake up. That shortness of breath when you lie flat. That heartbeat that suddenly feels irregular. That swelling around your ankles by evening. That tiredness that does not feel like normal tiredness. Most people wait for severe chest pain before they think something is wrong with the heart. But here is the truth. A struggling heart does not always scream. Sometimes it whispers. It may look like indigestion. It may feel like anxiety. It may show up as morning fatigue. It may wake you from sleep gasping for air. And the most dangerous mistake is saying, "It will pass." I'm Dr. Emily William, and today I'm going to show you the warning signs your heart may be struggling, which symptoms can wait for a doctor's appointment, and which symptoms mean you should call emergency services immediately. Stay with me until the end, because the final sign is the one people ignore most often, and it can be the difference between getting help in time and waiting too long. Before we begin, this video is for education only. If you have chest pain, severe shortness of breath, fainting, sudden weakness, or stroke-like symptoms, call emergency services immediately. Now let's begin. Number 1. Chest pressure, tightness, or heaviness. The first warning sign is chest pressure. Not always sharp pain, not always dramatic pain. Sometimes it feels like pressure, tightness, heaviness, burning, fullness, a band around the chest, a weight sitting on the chest. Many people mistake this for gas, acidity, heartburn, or stress, and sometimes it is indigestion. But if the discomfort is new, unusual, comes with activity, or lasts more than a few minutes, do not gamble. Heart-related chest discomfort may spread to the left arm, both arms, jaw, neck, back, or upper stomach. It may come with sweating, nausea, breathlessness, weakness, or a feeling that something is seriously wrong. If chest pressure appears suddenly, does not go away, or feels worse than anything you have felt before, call emergency services. Do not drive yourself. Do not wait for someone to pick you up. Do not lie down and hope. With the heart, minutes matter. Number 2. Shortness of breath when lying flat. The second sign is shortness of breath when lying down. If you used to sleep with one pillow, but now you need 2 or 3 pillows to breathe comfortably, pay attention. This can be a sign that the heart is struggling to pump blood forward. When you lie flat, fluid that was sitting in the legs during the day can move back toward the chest. A healthy heart handles that extra fluid. A struggling heart may not. Then fluid can back up into the lungs. That is why some people feel breathless at night or wake up gasping. Think of your lungs like a sponge. If fluid builds up, the sponge becomes waterlogged and there is less space for air. This can be a warning sign of heart failure. If you are regularly waking up breathless, needing extra pillows, or sleeping upright in a chair, call your doctor soon. If breathlessness is sudden, severe, or comes with chest pain, blue lips, fainting, or confusion, call emergency services. Number 3. Waking up gasping for air. The third sign is waking up suddenly at night feeling like you cannot breathe. This is different from normal snoring or waking briefly. This is a frightening feeling of suffocation that forces you to sit up, open a window, or gasp for air. Doctors call this paroxysmal nocturnal dyspnea. It can happen when fluid backs up into the lungs during sleep because the heart is not pumping efficiently. This symptom is important because many people live with it for months and never mention it. They adjust. They sleep in a chair. They add pillows. They tell themselves it is age. But your heart may be asking for help. Do not normalize nighttime breathlessness. Number 4. Swelling in the ankles, feet, legs, or belly. The fourth sign is swelling. Swollen ankles can happen from standing too long, salty food, vein problems, kidney issues, or medication side effects. But swelling can also be a heart warning sign. When the heart struggles to pump blood forward, fluid can collect in the lower body. Watch for tight shoes, deep sock marks, ankles swelling by evening, legs feeling heavy, belly swelling, sudden weight gain over a few days. A simple clue is pitting edema. Press your finger gently into the swollen area for a few seconds. If it leaves a dent, mention it to your doctor. Swelling plus shortness of breath, fatigue, or needing extra pillows at night should be checked quickly. Number 5. Irregular, racing, or fluttering heartbeat. The fifth sign is an unusual heartbeat. A skipped beat now and then can happen from stress, caffeine, poor sleep, dehydration, or anxiety. But a heartbeat that feels irregular, racing, fluttering, or all over the place should not be ignored. One important rhythm problem is atrial fibrillation, or AFib. In AFib, the upper chambers of the heart beat irregularly. This can allow blood to pool and form clots. If a clot travels to the brain, it can cause a stroke. Warning signs include fluttering in the chest, racing heartbeat, irregular pulse, dizziness, shortness of breath, weakness, chest discomfort. If your heartbeat is irregular but you feel otherwise well, book a medical appointment and ask about an ECG. If the irregular heartbeat comes with chest pain, fainting, severe breathlessness, or weakness, seek urgent help. Number 6. Extreme fatigue that feels different. The sixth sign is unusual fatigue, not ordinary tiredness, not "I had a busy day" tiredness. I mean tiredness that feels heavy, strange, and out of proportion. You may feel exhausted after simple tasks. Walking across the room may feel harder. Getting dressed may feel like effort. You may wake up tired even after sleeping. A struggling heart may not pump enough oxygen-rich blood to the muscles and brain. When the body does not get enough circulation, everything feels harder. Fatigue can also be a warning sign of heart attack, especially in women, older adults, and people with diabetes. If fatigue is new, sudden, severe, or comes with chest pressure, sweating, nausea, breathlessness, or dizziness, do not ignore it. Number 7. Loud snoring, gasping, and morning exhaustion. The seventh sign is sleep apnea. This is when breathing repeatedly stops or becomes shallow during sleep. It can cause oxygen levels to drop again and again through the night. Signs include loud snoring, waking up gasping, pauses in breathing noticed by a partner, morning headaches, dry mouth, daytime sleepiness, high blood pressure that is hard to control. Sleep apnea strains the heart because every oxygen drop forces the body into stress mode. Over time, it can contribute to high blood pressure, irregular heart rhythms, heart failure, and other heart problems. This is not usually an emergency, but it should be evaluated. Ask your doctor about a sleep study. Number 8. Dizziness, fainting, or feeling like you might pass out. The eighth sign is dizziness or fainting. Dizziness can come from dehydration, low blood sugar, medications, inner ear problems, or standing too quickly. But it can also come from heart rhythm problems, low blood pressure, valve disease, or poor circulation. Fainting is especially important after age 50 or 60. If you faint, nearly faint, or feel dizzy with chest discomfort, palpitations, shortness of breath, or weakness, seek medical attention. Your brain needs steady blood flow. If the heart cannot provide it, dizziness may be the warning. Number 9. Cold sweats, nausea, or indigestion-like discomfort. The ninth sign is cold sweating, nausea, or what feels like indigestion. This is where many heart attacks are missed. Some people do not feel classic chest pain. Instead, they feel nausea, cold sweat, upper stomach pressure, burping or indigestion, jaw discomfort, back discomfort, sudden weakness. If indigestion feels unusual, comes with sweating or breathlessness, or does not improve like normal acidity, take it seriously. A heart attack can pretend to be stomach trouble. Number 10. Reduced exercise tolerance. The 10th sign is losing stamina. Maybe you used to climb stairs easily, but now you stop halfway. Maybe walking to the mailbox feels harder. Maybe you avoid activity because you get breathless, tired, or chest pressure. This can happen gradually, so people adapt without noticing. They walk less, they sit more, they stop going out, they blame age. But reduced exercise tolerance can be a sign of blocked arteries, heart failure, valve disease, rhythm problems, anemia, lung disease, or other serious conditions. If your activity level has dropped because your body cannot keep up, get checked. Emergency rule. Call emergency services immediately if you have chest pressure lasting more than a few minutes, chest pain with sweating, nausea, jaw pain, arm pain, or shortness of breath, sudden severe breathlessness, fainting with heart symptoms, blue lips or severe weakness. Stroke symptoms, face drooping, arm weakness, speech trouble. A racing or irregular heartbeat that will not settle and makes you feel unwell. Never worry about wasting time. In emergency medicine, doctors would rather check you early than see you too late. Final message. Your heart does not always warn you with dramatic pain. Sometimes it warns you with breathlessness, sometimes with swollen ankles, sometimes with fatigue, sometimes with a fluttering heartbeat, sometimes with nausea, sweating, or indigestion, sometimes by waking you from sleep, gasping for air. Do not panic over every symptom, but do not dismiss symptoms that are new, persistent, worsening, or unusual for you. If this video helped you, comment below. Which heart warning sign do you think people ignore most? Chest pressure, breathlessness, fatigue, swelling, or irregular heartbeat? And share this video with someone over 50. One early warning sign recognized in time can protect a life.